Okay, I see this is slowed down, so I'm going to go ahead and get started then this afternoon. Welcome to this program on medical aid in dying and a little bit of a discussion about what's happening in Springfield this year around this issue. My name is Ed Yohnka. I'm the Director of Communications and Public Policy from the ACLU of Illinois. You'll be hearing this afternoon from my colleague, Khadine Bennett, who is the Advocacy and Intergovernmental Affairs Director here at the ACLU, and Chloë King, who is with the Compassions and Choices Action Network as a senior organizer. Before we begin, a couple of notes. For those of you who are ACLU members and ACLU activists, I do want to know we are aware, obviously, there's lots going on at the federal level. There are lots of issues happening that the ACLU is working on. One of the ways, and we're going to be talking about a lot of those in the days ahead, but one of the ways that we believe that we can protect against the infringements of our freedoms at the state and local level is to expand basic freedoms at that level. And that's what we really are spending the next hour talking about. What we'll try to do is talk a little bit about the issue of medical aid in dying, then talk about the proposed legislation in Springfield, then talk a little bit about what you can do as a citizen, as a resident, as an activist in order to participate in helping to bring this measure to bear and to enactment in Illinois. And then finally, we'll take your questions. And we're going to try to make sure we reserve as much time as we can with that. Two quick housekeeping notes as we're starting. We have live captions for today's event. To turn them on, please click Show Captions at the bottom of your Zoom window. Again, at the bottom of your Zoom window, you should be able to press on that closed caption button and say and press the closed captions to say show captions. That should help you with that. Secondly, if you have a question, you can submit it in the chat while the conversation is happening. You know, for those of you who forget your question along the way, as maybe I do from time to time. So your question will already get into queue if you ask it through the chat function as the process is going along. And then we'll also open up to other questions. If for any reason you have technological difficulties, you can messenger ACLU-IL events through the chat, and they'll be able to help you out with any technical issues that you might have. And with that, we are going to get started. So I'm going to begin by turning this over to my colleague, Khadine Bennett, to talk a little bit about this issue and why this issue is a fundamental one to civil liberties and civil rights.
So thank you so much, Ed, and thank you for everyone who are here today. You know, people sometimes are curious about why the ACLU of Illinois, ACLUs generally care about this issue. And that's because we support bodily autonomy. We believe that all people should have the ability to access the full range of healthcare options, and that ability shouldn't be limited based on what state they live in. It's similar to how we think about access to reproductive health care, gender-affirming care, and that principle applies here as well. So I know for Compassion and Choices, it's a pretty understandable connection there, but this is an issue that organizationally we've been committed to for quite a long time. So I think probably a year after the first law was passed, this was something that we've been interested in. So really excited to be able to partner with Compassion and Choices on this, along with other folks in our coalition. And I'm going to hand it over to Chloë to talk about what this bill does.
Hey folks, so I'm going to share my screen just so that I can show y'all some slides and we can work through this together. Okay, can everybody see? Perfect. So first off, let's talk about what medical aid in dying is. Medical aid in dying allows a terminally ill adult to request and receive a prescription for medication that they may choose to take in order to bring about a peaceful death. To qualify, You have to be mentally capable, able to self-ingest the medication, and have a prognosis of 6 months or less to live. Compassion and Choice's goal is to make medical aid in dying an open, accessible options in all states and a standard of care for end-of-life options. So 71% of Illinois likely voters support medical aid in dying based on an impact research poll that was done in February of 2023. I'm not going to talk through this too much, but I will let you all look at this slide for a little bit and take a look at this crosses age, it crosses race, religion, gender identity, and by a 55-point margin, voters who identify as living with a disability also support medical aid in dying. So you see really consistent support all across the state, which was really great for us to see. We've seen tremendous momentum in the number of states with medical aid in dying authorization. So currently, medical aid in dying is authorized in 10 states, as well as Washington, D.C. That means 1 in 5 U.S. residents now live in a jurisdiction where this option is available. Most authorizations are a result of legislation. A few are due to ballot initiatives, referendums, and court cases. We need to get a state in the Midwest to authorize this, though. So there's not a single state right now in the Midwest that authorizes medical aid in dying. In Illinois, CNC, like they said earlier, we've joined with Final Options Illinois and with ACLU of Illinois to form the Illinois End-of-Life Options Coalition. As we move forward, it's really up to all of us here today throughout the state to think about how we can build a groundswell of support to move this issue forward. So right now, there are 2 sort of identical bills, one in the Senate, one in the House. They're both called the End-of-Life Options for Terminally Ill Patients Act. This one, SB 9, was introduced January 13th, 2025 by Assistant Majority Leader Linda Holmes. It's currently assigned to the Senate Executive Committee. And on February 21st, there was a subject matter hearing held by the committee to look at this issue. Chief co-sponsors are Senator Laura Fine, Senator Karina Villa, Senator Christina Castro, and Senator Adrienne Johnson. And then additional co-sponsors are Senators Laura Ellman and Mary Edley Allen. On the House side, just a day later, HB 1328 was introduced by Majority Leader Robin Gable. That's assigned to the House Executive Committee, so I know that can sometimes be confusing because they have the same name, but they are 2 different committees. And then again, you can look at the chief co-sponsors and the additional co-sponsors on this bill. Out of those who utilize medical aid in dying, 88 receive hospice and/or palliative care services at the time of their deaths. There's a nearly equal utilization of medical aid in dying among men and women. Over 75% of people who utilize medical aid in dying are able to die at home, whereas only 30.7% of the general population is able to do so. The at-home death rate for those who opt for medical aid in dying is almost 2.5 times higher. The rate at which people of color access medical aid in dying prescriptions appears to be consistently lower than white populations. However, differences in data collection and reporting complicates comparisons across states. The most common qualifying diagnoses include terminal cancer, neurodegenerative diseases like ALS or Huntington's, and cardiovascular diseases. This is just a quote that I like to share from our terminally ill advocate, Deb Robertson. She said, "I will die soon, that is for certain. The real question is, how will I spend my last days?" So I'm going to turn it over to Khadine to talk about some of the work in Springfield, and then we'll come back and talk more about messaging and what you can do.
Great, thanks so much, Chloe. So wanted to start with what we've done as we thought about drafting. So one of the first things we did is to identify entities of interest and folks who may be opposed or interested in this legislation and try to, in advance, address their concerns. So one of our starting points was looking at the laws that passed in different states. So there are 10 states plus Washington, D.C. And we had a lot of collaborative conversations with Compassion and Choices to talk through what they've seen on the ground, lessons learned, best practices, and thinking about implementation. So there are three groups that we were thinking about. One is the medical community broadly. So in Illinois, we had the Illinois State Medical Society. We shared a draft with them, talked through any of their thoughts on the bill, suggestions for improvement. We also spoke to the Hospital Association, the Illinois Hospital Association, got their feedback, made clarifications that addressed their concerns. A really important entity for us was disability rights orgs. The ACLU of Illinois, we do work on behalf and with people who are living with disabilities. And it was really important knowing that there has been some concern by some members of the disability community about the potential harm of these kinds of laws. So started with speaking with Access Living to share language and ask for their feedback. And we had a series of conversations with Access Living members of their coalition, one-on-ones, with both the organization, with CNC, and with our sponsors. And we really wanted to make sure that we were able to share the guardrails that existed in the law and open up for any other ideas that they may have in terms of how we can make a law stronger. I think there was agreement that a bill around medical aid in dying should include folks who are living with disabilities, meaning that they shouldn't be excluded from coverage of this bill if it were to become law, because there are folks who are terminal, who may be terminal and who may also be living with a disability. And so there was agreement that it's a non-starter to have any kind of exclusion there. And then there was also a recognition that folks living with disabilities may want to have this option at some point. And there's also recognition that while they may have concerns, they don't speak for all of the community. We definitely believe and trust that people living with disabilities are able to make decisions about their health and their lives, and we trust them to decide about whether or not they would want to utilize this option. I think there was also agreement that the medical system is broken and it doesn't work for many of us. But for our coalition, we believe that it was important for this issue with the health system to not result in closing off this opportunity for folks who could be qualified patients if this is the kind of care they wanted at the end of their lives. We know that some people are able to go to another state if Illinois doesn't have this law, and we've talked to them over the years. But we know that a majority of folks don't have the luxury to move to another state as they're facing their end of life with a terminal diagnosis, and they may not be able to have their families go visit them. So we wanted to make sure that this kind of care, that's trusted care, is here in Illinois. We continue to be open to language about how we can make our language stronger, even at the subject matter hearing a few weeks ago, and that's something that we are continue to be open to. We've also made clear that we aren't talking about assisted suicide or laws that are in other countries, as Chloe, may have touched on. Deb, one of the things she says when she talks about this issue is that she wants to live, but she knows that she's going to die. And part of why she's using her remaining time with us to advocate for this issue is because that fear of what can happen at the end of her life is something that pushes her to want to make sure that this option is available here in Illinois. The final group is religious entities. We don't want anyone to be forced to offer medical aid in dying in the same way we don't want anybody to be forced to access medical aid in dying. So we are very clear in the law that the Healthcare Right of Conscience Act, which is a law that allows for folks to not participate in medical care that violates their conscious beliefs, but it also has an obligation that if they don't provide the care, they have to make sure to transfer people's medical records and share with folks where they may be able to get that care. So just wanted to give you that framework of understanding in case these things come up as you're talking to legislators. So I am going to pass it back to Chloe. And if you've never been on a call with me, I am a very fast talker. I think it's the lobbyist in me. So apologies in advance. If you need me to slow down, just put something in the chat. So you've been forewarned. Chloe?
No, that's perfect because it gives me more time to take up more time than I thought I would. So here, I'm going to share my screen again. We're just going to talk a little bit about being a messenger. We all have our own views and reasons for supporting medical aid in dying. So I just want to acknowledge that while we all might not be coming from the same place, sometimes our personal views or particular use of language are not always the most effective way to accomplish what we're trying to do here. It's all about being an effective advocate and influencer. One thing, if you walk away from anything from this with any one piece of information, I would say remember that medical aid in dying has been safely practiced in numerous authorized jurisdictions with no cases of abuse. Not one. It's all about patient autonomy. The patient is in charge. They request the medication, they take it, and they can change their mind at any time. It also helps far more people than those who choose to use it. Studies show that having medical aid in dying as an option relieves fear and anxiety, even for those who never choose the option. And also, please remember that medical aid in dying is optional for physicians and for patients. No one is required to use it. No doctor is mandated to provide it. It's illegal to force someone to use it, and penalties for coercion and misuse are severe. So a key message is that terminally ill adults should be able to make their own end-of-life care decisions based on their values and priorities in consultation with their doctor, their loved ones, and their faith or spiritual leaders if they have one. One thing that can be helpful is knowing which terms to avoid and what some alternatives may be. So if you look at like the word control, a lot of people, you can see Americans believe only God controls life and death, so we should really avoid using that term. Choice can sometimes be something that we have softened up on over the years. We often use the term decision-making instead. One thing that I find kind of interesting is rights. A lot of times the average person doesn't think about death in terms of legal rights the way that a lot of folks here might. Love and family are some of the most important things in most people's lives, especially at the end of life. So using the word rights can sometimes confuse people when you're having these conversations. We don't like to use the term death with dignity, even though that was what the first law was called. Many people can be offended by this term because that would imply that medical aid in dying is the only way that you could die with dignity, which we don't agree with and don't think is true. So think about instead what kind of death aligns with each person's individual values, beliefs, and priorities. And then last but not least, we don't like to use the term self-administer, and the reason is because that could mean a lot of different things. We prefer when communicating with the general public to use the words take or self-ingest, so that way you're not thinking about injection or other things that aren't an accurate description of what medical aid in dying is. I personally prefer to say take or self-ingest as well. I say take a lot or consume, and I talk about what it is. So we'll get to that. Explaining the process, that can really demystify what we're talking about here. This is the basic 4 steps if you want to get down to it, which is that the patient will take an anti-anxiety medication. They'll take an aid in dying medication, usually by mixing it in water and drinking it directly out of a glass or using a straw. I have heard of somebody who used one of our testifiers, her son ate an orange sorbet. If the person's unable to swallow, you can also use a feeding tube or a catheter to ingest the medication, but that person needs to be the one that would push the plunger, so it's still self-ingestion. Patients' breathing at that point would then slow down and they would drift off to sleep. Usually it happens just within a few minutes, and then their breathing stops typically within an hour or 2. Peaceful death occurs within just a few hours. One thing that's really important to remember when you're having these conversations is to demonstrate respect. You can never go wrong with taking the high road. We don't want to attack opposition. We want to focus our arguments on facts. Casting aspersions on our opponents makes us less credible to the public. A calm and reasonable tone is never the wrong approach. Really avoid attacking religious institutions or beliefs. Many of us want to argue about all kinds of different things when it comes to our own personal beliefs, but we don't want to undermine anyone's beliefs, and we don't want to undermine the support they may have for medical aid in dying, because people rightfully will tend to defend groups they're a part of when that group is being attacked. We also want to avoid blaming healthcare providers. A lot of people think healthcare providers should be able to opt out if they're participating in the law. We agree with that. But the thing is, most physicians support medical aid in dying. We need to work to build support in the medical community. remembering that physicians have the right to opt out, we have to respect that as a personal decision. I think I just keep repeating the same thing. This is a personal decision. This is up to the individual. So attacking any one group who doesn't support medical aid in dying is not actually getting our message across. Our message is that this should be a personal decision that people get to make and an option that they don't have to choose. Last but not least, leave room for people to change their mind. We support people having and using options that are right for them. There's no need to argue. Simply state why you believe medical aid in dying should be authorized and then listen. Leave people room. People are often just one experience away from agreeing that medical aid in dying is a good option to have. So there's no need to make a person feel defensive about something that's already a very emotionally intense conversation. That's not an easy conversation for anyone to have. So going into it with that understanding can make it a little bit harder to get to the real conversation. Last but not least, if you have any questions for me, you can reach out to me. My email is here. And then also Callie Riley, our regional advocacy director, is out right now. But when she's back, you're welcome to reach out to her as well. And I'm happy to answer questions in a little bit. But for now, we're going to move it over to Ed.
Great. Thank you, Chloe. A couple of things. First of all, I would just say, Chloe, to your point about the use of the word right or rights, that's actually something we've seen consistent in our message research on a whole range of different issues. The idea of rights is one that people sometimes think if somebody else has a right, they lose a right. And so sometimes just talking about people's values or talking about fairness, talking about choice in that way, it tends to be a position that sort of moves us along where this is concerned. So thus far, you've heard a lot about the importance of the issue. You've heard about its broad support, which I think is probably a critical thing. You've also heard about sort of the care in drafting the legislation, as well as some messaging tips. So now we're going to pivot and go back to Khadine for a few minutes to sort of talk about the role you can play and how you can, reach out to your legislators to support this piece of legislation. So Khadine, we'll turn it back to you.
Great. And I'm going to share my screen. I'm going to try my best, Caroline, to speak slowly. I'm going to channel my inner Chloe, and let's see how this goes.
And
okay.
Caroline is my new hero, by the way, for asking you to slow down.
Well, let's hope I'm successful for both of us. Okay, so I just want to make sure. Sorry, my sharing screen and multitasking is not my friend. Okay, so you all will see that there are two bill numbers, SB 9 and HB 1328. SB 9 is sponsored by Senator Holmes. That's the main vehicle that we're likely going to be moving. HB 1328 is sponsored by Rep. Gable, and we wanted to introduce them both in both chambers, but our goal is to move SB 9 from the Senate to the House. When it goes to the House, then it will be sponsored by Rep. Gable there. So for the purposes of this conversation, what does success look like? We want you to have the tools and the information you need to reach out to your senators and reps in support of the End of Life Options for Terminally Ill Adults Act. And I'm going to be saying that title because that's what the bill is titled in the law, well, the title in the bill that we hope will become law. And we also want to make sure that you are, after this conversation, you're ready, confident, and excited to reach out to your elected officials. So the first thing is knowing who represents you. That is really important because that's the first step to making change. We want you to just make sure you remember that who's representing you at the state level is different from your congressional representatives. If you don't know who your reps are, we can make sure that you have a link so that you're able to get that information, and that's probably happening now in the chat. But I see a chat button go off. There is a buffet of options on the advocacy menu, but for today, we will only be talking about the first 4 of those. And so that would be in-person office visits, remote virtual meetings, phone calls, letters, and emails. So in district is when you visit a legislator at their office in the district that they represent. There are lots of advantages of in-district visits. Usually there's more time to discuss issues. It's more of a relaxed environment. You get a personal connection with the legislator. If you're looking for the best times for spring session to do in-district visits, that's when they are not in Springfield. For the Senate, the weeks of March 24th, April 14th, and April 21st, they will not be in Springfield. And for the House, that will be the weeks of March 31st and April 14th. So it will be a good time for you to call their district office and set up a time for you to meet with them. There are some legislators who are in their district offices on Mondays and Fridays of when they have a break in session. So they're normally in Tuesday through Thursday, so that Monday or Friday could also be options. But I really encourage you all to take advantage of these in-district visit options. The other way to meet your legislators are through a virtual visit. So that's if you're using some kind of video conferencing system like WebEx or Zoom, or if you want to do Teams, or sometimes if FaceTime is what you have, those can work as well. Some of the advantages are that it can be easier to schedule. It's a good option for folks who can't get to a district office, and it still allows for some level of personal connection. So some of the best practices, you want to set up an appointment, confirm 1 business day before and also the morning of. Things are quickly shifting. So sometimes if you schedule a meeting maybe 2 weeks before and even the day before, things are fine. There may be something that pops up the morning of. Generally ask for 30 minutes, but it could be as short as 15 minutes or as long as an hour. It depends on how much time your senator or representative has. So it's important to have a clear goal for the meeting. And in this situation, your goals and asks are 3. 1, you want to explicitly ask, do you support the End of Life Options Act? And Senate Bill 9 generally is the bill that you would refer to, though if you're talking to somebody in the House, you may want to mention House Bill 1328. And will you vote yes? So if you just asked if they support it, they can say, yeah, sure, Khadine, I support it. It's great. But that may not be a, yes, I am going to vote for it, or yes, I will, take that step that you're thinking they're saying yes to. If they are a supporter, you can ask them if they would consider co-sponsoring. And if they say, no, I don't feel comfortable, co-sponsoring the bill, that can be okay. Our goal is to have folks who are going to vote yes. And co-sponsoring is a nice to have, but if they're a supporter and that means they're going to vote yes, that's more than enough for us in many circumstances. And then the other place is that you're going to gather information if they're undecided or opposed. And if you get that information, both if they're supporting, they want to sponsor, or if they're undecided or opposed, it's always great to share that information with Chloe or myself so that we, and in my lobbyist role, I'm able to confirm what they've said to you is what they've said to me. So you want to arrive on time and be prepared. In person, 10 to 50 minutes early. Via Zoom, 5 to 10 minutes early. And if you have materials to share, you can send them ahead of time. If you're meeting in person, it's helpful to bring extra copies with you. Always good if you're part of a group to know who's going to be talking about what and when. And then have a sense of your must-have items in case your meeting runs short or something happens and your legislator doesn't have the full time to meet with you. It's always good to confirm how much time your legislator has to meet. So you may have thought that you're having a 30-minute conversation and that pace might be different, but something may have popped up so you only have 15 or 10 minutes. So again, it's always good to confirm. And then the most important thing is sharing why this information is important to you. Numbers and facts matter, but sometimes a constituent sharing their personal connection to the issue can sway an elected official your way. So Do you have a personal connection? Like, are you somebody who's directly impacted? Do you have a family member, a loved one? Do you bring a unique perspective? Are you a person of faith, a healthcare professional, a person living with a disability, a hospice or end-of-life care volunteer? It's been really great to talk to legislators about this issue, and so many of them have talked about hearing from this issue from a constituent, and that's made the conversation with me as a lobbyist, either a first conversation or a follow-up conversation, really helpful, because it's not a theory, it's a thing that they've heard their constituents talk with them about. It's important to know no information is better than misinformation. So if you don't know the answer to a question, don't guess. You can always follow up with additional information or answers to questions, or you may just say, you know what, I don't know this information, but I can make sure that one of the lobbyists are able to get back to you with that information. Just if you are going to follow up, just don't forget to follow up. So that is always good practice. And if there is a follow-up item, that's another bit of information that can be helpful to us as lobbyists as well. So the important rule, you represent yourself unless you have explicit permission to represent an organization or a coalition. Your voice matters, regardless of whether you speak for an organization or just for yourself. And in these communications with legislators, being a constituent is a really, really important role to let them know that you care about it, about the issue. And then don't forget, don't end your meeting without making your ask. So you want to be direct. Can I count on you to support the end-of-life options for terminally ill adults? Say the bill number, and we describe it as legislation that would add medical aid in dying to the end-of-life options available for Illinois. You don't have to say it exactly like this, but it's just an example in case folks need it. And then the important, do you plan on voting yes on Senate Bill 9 or House Bill 1328? So just general considerations. Be prepared. It's really important to be clear about your ask, anticipate any questions, and have materials ready to share before your meeting. Be persistent. Don't give up. You can try multiple methods to reach the office or the scheduler. We don't want you to be aggressive, but do follow up via phone and email. I have been known to stop into office hours if I'm not getting luck reaching someone. And then also knowing who will be present. So making sure that you convey to the legislator who are the folks who will be attending. And don't forget, in order to represent an organization, you have to have that permission. So remote advocacy is what I would describe as calls, emails, or letters. And they can be helpful because it's time efficient, it's tracked by legislative staff, and there's potential for direct responses for legislators. I will say my ranking for these are calls, handwritten letters or postcards, or personalized action alerts. And one of the things that I've been hearing a lot is just the desire for legislators to get more calls from constituents on our side of the issue on this bill. So when it comes to calls, it's the best remote option. So during session days, you can call their Springfield office. During non-session days, you can call their district office. And you can call both offices if you want to make sure that they have the message that you are supportive of this issue. So some of the things we'd want you to do is identify yourself as a constituent, tell them you're in support of Senate Bill 9 or House Bill 1328. Ask your legislator if they've taken a position on the bill. If you know they are supportive or a sponsor, confirm that they're still supportive and thank them. If you're not sure, or if they haven't taken a position, you want to ask your legislator to support the bill. Sometimes you'll talk to a person, sometimes you leave a message on voicemail. If you don't get a person, definitely leave the message. We know that they definitely tally each morning to see who's called about what. Emails and letters are also very helpful. Handwritten letters or postcards, when legislators or their staff get it, they see that as people going the extra mile to convey information. A personalized action alert. So, the ACLU and Compassion and Choices, we send action alerts on these issues. If you take a moment just to, add that you're a constituent and why you care about this issue, I think that is really core. And again, we want to make sure to ask your legislator to support the bill, or if you know that they are a co-sponsor or the main sponsor, thanking them for their support. regardless of the tool you use, it's important to be respectful. It's important to treat all of the elected officials and their staff with respect, from the person who's answering the phone to somebody who's staff at the office to even the elected official who is against you on the issue. Treating staff and elected officials poorly, it really helps to move our work forward. And I know that for so many people, this is such a personal issue and there are lots of feelings involved, but that respect is core. So I hope, Carolyn, I was somewhat slower. I feel like I started slow and then I got back. So that is it on my end.
Great. Thank you, Khadine. So at this point, we're going to end the